My name is Jody Jacobson. I'm the founder and executive director of Healthcare Across Borders, which is an organization devoted to getting care by any means necessary to people across the country, including abortion care and gender-affirming care and all kinds of sexual and reproductive health care, including using telemedicine to provide care into banned states, which is a big part of the work that we do, having passed a number of SHIELD laws last year. But I am the moderator today of a panel I'm really excited about because Healthcare Across Borders also does work on the Comstock Act and other laws that are barriers or, in effect, landmines for the total erasure of essential health care in this country. I want to start by saying thank you to a couple of people. I want to thank my colleagues and partners at Pacifica Strategies, without whom so much of the work that we are doing would not be possible. I also want to thank Obet Montalvo, who's the greatest social media person ever. There he is. Nothing gets done by yourself, and I can easily say that Murched and his team at Pacifica they've been friends for a long time, and they're incredible allies, and I really appreciate them. I'm just going to go through very quick introductions for our panelists because we want to get to the meat of the issue. Hope you all met Anthony Comstock outside. We have an excellent panel here, and I am honored to be able to work with these people, and I mean that in the deepest sense of the word, because I love to work with people who want to get shit done, excuse my language, and all of these folks are people who get things done. So we are really deeply honored to have Senator Tina Smith from one of my favorite states, Minnesota. Senator Smith has a long record of working in labor and in her own business and being a leader in many different areas, including working at a Planned Parenthood and leading a Planned Parenthood. She has got a long history of working for people and their needs, no matter what position she's been in. And now, as a senator from Minnesota, she has been really one of those people in Congress who is willing to say what needs to be done. So she is for expanding the court, without which I don't think we can save this country. And she also has been a leader on repealing the Comstock Act. So really delighted to have you here, Senator.
Thank you.
Next to Senator Smith is Pamela Merritt, who I'm glad to say has been a friend for most of my life in the field, and also has been someone from whom I've learned a tremendous amount. She's also got a really sharp sense of humor and someone who creates the very clearest boundaries of what she wants to do and doesn't want to do, which I emulate, because I'm not very good at that. But Pamela is currently the executive director of Medical Students for Choice, which is a really important organization because many, many doctors throughout this country who work with Medical Students for Choice are, in fact, constituencies for the very policies that we need to see happen for public health and human rights in this country. And they are all over the country, and they are not only educated as medical professionals, but they're smart, savvy, and they move things. So Pamela, I'm delighted to have you here with us. She was also a co-founder of another organization called Repro Action, which is still in existence and is run by her former partner and is an amazing organization. And she's chair of the Guttmacher Institute Board of Directors. Next to Pamela is Nicole Regalado. Nicole is just a delightful person and another mover and shaker. She works for Ultraviolet, where she's VP of campaigns, and she's got 16 campaigns on any given day that are moving along. And I'm really, truly, when I say I'm in awe of her, I'm in awe of her. She previously worked for ICES, and for the ACLU, as well as Credo, another one of my favorite organizations. And Nicole has been a tremendous partner in the coalition that we've built to move Comstock, as has Pamela and MSF. And my main co-partner in this work is Sarah Lipton-Lubet, Lubette. I do this all the time and make her French.
This week I'll take it.
Okay. Really, we may all need to take it. So Sarah is the executive director of Take Back the Court Action Fund, and she is a leader on the effort to expand the courts, which, again, I'll say it again, we have to do it to save this country. Sarah also worked at many other places in the movement, and I've also known Sarah all along the way, National Partnership for Families, ACLU, and other places. So these are folks who know their stuff, and we are really grateful to have them with us. I just want to open by saying that the elephant herd in the room is what's happening outside the room. The fact that we are in a really crisis position right now regarding the election, and that were we to lose this election, we will not know the country that we live in, and many, many people across this country will not be able to get essential care. And that means essential care of every kind. There will be less health care and less good health care across the board. But right now, even now, as we see the bans that have spread across the United States, maternal mortality rates, excuse me, and illnesses due to pregnancy complications are rising rapidly. In states like Texas, where the rate of maternal illness and death among Black women has increased dramatically. It was bad before, it was really bad before, has increased dramatically since the passage of the abortion ban. And we already live in a country where, though we have tremendous wealth, we lag behind every other country of our similar income and development statistics on things like maternal health and infant mortality. So we're going in a bad direction in some ways, and we are the people, all of us here and all of us that we know, that need to change that direction and move forward. So with that, I want to start with the questions that we have for our panelists. And I want to start with Senator Smith. Let me just go right to Senator Smith. You've been leading efforts in the Senate to repeal the Comstock Act, and you've introduced a bill that would repeal the key anti-abortion provisions. I'd like you to tell us and tell the audience how you became so passionate about this. What was it about a law that most people don't know anything about, but which is sitting there, that brought you to know about it and for you to take such tremendous leadership on it?
Well, thank you, and thank you, Jody, and thanks to my esteemed panelists here, and thanks to all of the organizers and activists in this room who are doing the work of making our democracy work, and I'm just really grateful to all of you. I first started thinking about the Comstock Act, actually many decades ago. I was working at Planned Parenthood in Minneapolis, Minnesota. It was the early 1990s. And I saw every single day people walk through the doors of our clinic fully capable of making the best decisions for themselves and their families and their own bodies about what was best for them. And understand this is at a time when, right around the time of the Casey decision on the Supreme Court, which on the one hand protected, kept Roe in place, but it basically said, oh, states, as long as you don't put an undue burden on women's access to abortion, you can put restrictions on abortion. And I started to see this pan out, 24-hour waiting periods. It was the beginning of the whittling away of making abortion accessible to people in this country. And it got me interested in the way that abortion laws had been written over decades. And I learned a lot about it, and that's how I stumbled across the Comstock Act. And I'm like, what the hell? There's this old zombie law out there that if it were being enforced, of course it wasn't because Roe was still in place, could be used to completely ban people's access to abortion care and even contraception potentially. And so I was thinking about it, and then when it started to become clear, when Donald Trump appointed those justices to the Supreme Court, it was clear to many of us that we were going to lose Roe. The only question was when, and that drew my attention back to the Comstock Act, because that would be the clearest way to do something like banning the mailing of mifepristone. I'll tell you honestly, there were a lot of folks that were kind of anxious about this. I think There were some on the left that were hoping that nobody would notice. But of course, the right noticed. And of course, they were using it as a way, they were planning on it. You can read about that in Project 2025, and we can talk more about that. And that is really understanding that and also wanting to protect the excellent work of this administration to use all of their powers and authority to protect women's reproductive health care to the extent that they can. We wanted to, move carefully, but it was clear that we needed to do something to repeal the Comstock Act, and that is what led us to introduce the bill. I think it was, what was it, Rachel? Maybe 2 weeks ago, 3 weeks ago? Nearly half the Democratic caucus has signed on. We have support from many organizations, and I think it is on its way to being a really outstanding way of demonstrating what's at stake in this election and how we can use this to organize people around reproductive freedom as we head into the as we are right now in the middle of it.
Can I ask you to summarize for everyone what your bill attempts to do and how?
So, the Comstock Act is this old 150-year-old zombie law that basically forbids the mailing of any material that is obscene or lascivious or could be used to contribute to an abortion. And so what our bill does is it repeals the main provisions of the Comstock Act. It leaves in place whatever capacity is in that old law that the Justice Department currently uses to prosecute people for child pornography. But fundamentally, it repeals the parts of the law that could be used to ban abortion. So a future President Trump, God forbid, could not use the Comstock Act. If we repealed it, they couldn't use the Comstock Act to ban medication abortion or in some, potentially all abortions without ever having an act of Congress.
And can you tell us a little bit about what you're doing and how you're doing it to educate other members about this law and how they're responding? Like, what is it that you're finding in terms of opportunities and obstacles with other members of Congress?
Yeah, well, so, first of all, I'll just be completely honest. I actually think that being pro-reproductive freedom is a bipartisan issue in this country, but it is not a bipartisan issue in Congress. We need to understand that the anti-abortion forces are determined to use this as a tool, though I think it's inappropriate. I think it's illegal to use it as a tool. So part of it is just educating my colleagues about the fact that this law is there and how it could be used. For example, if you are a member of Congress representing a state that has in place state protections for abortion rights, it's important for that member to understand that if a future administration tried to use Comstock, it would have direct impact on the rights of people in your state, even though you might have protections, because the federal law preempts. Helping people to understand that, helping them to understand that the major reproductive rights groups are supporting this, the AFL-CIO is supporting it, Indivisible is supporting it, Take Back the Courts is supporting it, giving them just an understanding of how it fits into the current political environment is what we're doing right now.
Thank you so much. So Sarah, I wanted to ask you to give us a little bit of a sort of briefing on how the right has used a methodical strategy to get us where we are, and how Comstock fits into that methodical strategy, especially since, we've been talking about it since the fall of Roe, but it's still there, and how did we get where we are now?
How much time do we have? This could take a while. So, in brief, I think where we are right now with the dangers that the Comstock Act poses, should an administration ever get in place that wants to use it, is really almost a perfect microcosm of the different ways that the right has moved over the last however many decades to take control of various institutions, of our courts, of state legislatures, to move really just radical policy forward that they would never be able to do electorally. And that's really the story, or a big part of the story behind Dobbs, and that's a big part of the story behind Comstock. So, why are we here? Dobbs. Dobbs is how we got here. the rights control and the manipulation, I got so mad, of the courts is how we got to Dobbs. And, you know, yes, that was a decades-long goal of the right, but it was never the end goal. And we're seeing that now, right? Overturning of Roe was just the beginning of everything that they're trying to move to put into place now. And I think another theme that's really clear here is that they understand what the senator just said, that reproductive rights are broadly popular. People want them. Go figure. Go figure. We want to be able to control our own bodies. Who knew? And so you'll see Republicans now saying, kind of with a, you know, big oversized wink, oh, national abortion ban? We're not going to push that through Congress. And then it's the stage whisper, because we have Comstock, and so we're just going to have DOJ take care of it for us, right? And that is part of their strategy, explicitly part of their strategy, is to try to mislead the American people about what their intentions are until it's too late. And I'm not, you know, divining that from some sense of what I think about the nature of these people. They've said it out loud. They put it in print. It is written in Project 2025. Jonathan Mitchell, who is one of the people behind Texas's SB 8 bounty hunter anti-abortion law, and Donald Trump's personal lawyer, said to the New York Times, quote, "We don't need a federal ban as long as we have Comstock on the books," followed by, "I hope pro-life, anti-abortion, organizations shut up about it until after the election."
Right,
End
don't
quote.
talk about it, right.
Right? So, I mean, this is the strategy. And in the face of that, the only thing, not the only thing, the necessary thing that we need to do is to not shut up about it, is to reveal the strategies to let people know that this is what is going to happen if those folks get into power in the next administration. And that's why bills like the senators are so essential in order to educate folks and repeal the damn thing.
Thank you, Sarah. I just want to note that this sort of playing with words and terminology and what we're going to do and what we're not going to do has been historically a pattern. They'll say, well, we just want to, you know, make them safer, make abortion safer. But that was never the goal. It was always banning abortion. We just want to let the states decide. But that was never the goal, because they got the Supreme Court in place to take it, you know, to basically throw it out and then start to consider other bans on abortion nationwide. And with respect to Project 2025 and the Comstock Act, basically it's the new coffee boy. Donald Trump doesn't know anything about it. He has never heard about it or seen it, except he has all the people who created it working on his staff. So these are things that are real. They are not, you know, don't listen to the noise, know what they have done before, and take from that what they plan to do, because I think it's really important to know that. So next I want to just go to, but I did want to ask you one more question, Sarah. Is there anything about the effort to expand the court that you could tell us about right now that would be, you know, what is the prospect for that in terms of our right, taking back our rights and those kinds of things? What needs to be done?
We need to expand the court if we want to take back any of our rights. That's the short version of it. You know, I said we're here about Comstock because of Dobbs. And Dobbs happened because of a court packed by right-wing extremists over time, whose goal is to amass power for themselves so that they can exert power and control over the rest of us. And that's really what it comes down to, is power and control. And so to be able to even begin the process of righting the ship, starting to move back in the direction of an actual democracy and not a juristocracy, we have to rebalance the court. We have to disempower folks like Sam Alito and Clarence Thomas, who want to see us all living under some kind of 1700s fever dream. And I'm looking around and I'm thinking, I don't really think actually anybody in this room wants to live that way. That is why I think court expansion is a necessary part of any pro-democracy effort that we all engage in, of any effort to protect our reproductive rights, of any effort to protect our voting rights, our civil rights, the environment. Because if we don't do that, this court is coming for everything. Senators, anything you want to add to that?
Well, I appreciate that so much, Sarah. And I think, my view of this is when you live in a democracy and you see something that's broken, you see a system, an essential system, our judicial system that is broken, then we have a responsibility to try to fix it. We can't just wait for the court to rebalance itself on its own. We have to think about the actions that we can take right now. And the action that the Constitution clearly gives Congress is to establish the number of justices that serve. And there are many actually good logistical reasons for adding justices, including the fact that we now have 13 district courts and circuits, and there are only 9 justices. It is just a practical and common sense way. And when people say, oh, that was tried once in the 1930s, understand this is not the 1930s, although Mr. Comstock might think that it is. It is our responsibility, I think, to take action to repair the damage that's been done to the courts, and this is the constitutional and clear way to do it.
Thank you. So Pamela, can you give us a sense of what the effect has been on providers and the people that they serve of abortion and other bans, like bans on gender-affirming care and so forth? What is happening with providers and the people they serve?
Wow. So the effect has been devastating. There's a term that we didn't kind of got out of practice of using called moral distress. And moral distress is when a medical provider and nurse are forced to endure something that is preventable and that they morally could take action on. And every single day, people are walking into clinics and hospitals all over this country and are being forced to deny care that they have been trained to provide, that is absolutely the best standard of care for their patients, by laws that have nothing to do with science. And that is not sustainable. So the impact has been that people are leaving. Providers and medical students and physicians who aren't necessarily providing reproductive health care are uncomfortable with the environment in which they're a physician. So this isn't just about whether or not OB-GYN care is leaving, and it is. I predicted when we lost Roe that it would take about 5 years to see the regionalization of OB-GYN care. I think it's gonna happen faster. But this is about people who wanna be an allergist or a podiatrist, but doctors tend to flock together. And it's hard to work with people who are dealing with what is really jarring. And the best example we ever got as a country is watching, I hope people witnessed just the heroic efforts of healthcare providers during the COVID pandemic, particularly the first year or two. The moral distress and lack of mental health support for providers was through the roof. Many people fled the healthcare industry after that because it is not an industry that's particularly kind to people who are suffering from the impact of having to not provide care. But I want to be extremely clear, what we are asking medical students, residents, and providers to do is to walk into a medical theater every single day and be hindered by either a board from a hospital, by the clinic or health practice lawyer, and be forced to watch their patient either suffer potential death and harm, preventable pain, the loss of their fertility, which I have personally had to be the ear on the phone to a provider who was in great distress over witnessing that. All of these things have been preventable and are treatable. Maternal mortality is preventable. The vast majority of maternal mortality in this country, completely preventable. And I don't know anybody who goes to med school to watch people die a preventable death. And for every person who dies, there are thousands of people who have a hysterectomy that didn't need to happen, who have an ovary removed that should not happen, who had an ectopic pregnancy explode when 2 years ago they would have gotten a surgery and gone on to have as many children as they wanted to. But we often talk about, and we should, center patients when we're talking about reproductive health care. When we're talking about health care in general, my role at Medical Students for Choice is to help people understand how it is not sustainable for physicians and for the medical profession to be in this position. It's not sustainable because it's a soul-crushing daily grind, and the fact that they're still doing it is a credit to them and their integrity. But when you talk about genetic counselors, when you talk about nurses, when you talk about complex family planning, all of those things have far more interaction with crisis. And what they used to do is practice medicine when they faced crisis. And what they now do is get into an argument with a fleet of lawyers because a state legislator has written something so vague and so imperfect that a hospital is going to err on the side of caution.
Thank you so much, Pamela. So what are some of the harms that would come from Comstock beyond just abortion? Like what do you see happening with people's needs and health?
Absolutely devastating outcomes. We are in a crisis of medical education, but right now, already, 2024. When you combine the attacks at state levels on gender-affirming care with the attacks on reproductive health care, those are both legislative, the weaponization of state legislatures against the profession of medicine. And if you layer onto that the application of the Comstock Act, you are going to create a maternal health crisis, and we're going to learn a really harsh lesson that we haven't learned in quite some time, which is that when mothers and women don't thrive, our communities don't thrive. When people are dealing with unplanned pregnancies and catastrophic outcomes, then your community will feel it. But as providers, we have a physician shortage right now. I'm sure Maryland has one, every other state does. Most of the banned states are dealing with physician shortages. Right now, if you're a traveling nurse, you can basically name your price and get a job anywhere. We have a shortage of nurses. As I said, it's not sustainable, and they're not martyrs. So we're already seeing people not want to go into residency programs that are in abortion ban states. If the abortion ban state has also tinkered with gender affirming care, those numbers are higher. And when I say numbers, 22% decline of people wanting to match into the state of Missouri, which has 2 premier programs in OB-GYN, one at Washington University in St. Louis, one at UMKC. When you look at the Louisiana, Tulane was a top 5 program, and now people are like, I would never go to Louisiana. You can't have a hospital without residents. You don't have a healthcare system without doctors and nurses and providers. And anybody who thinks this can't happen in their back door needs to look at the percent of their state that's rural and then Google your state rural hospital closures.
Mm-hmm. Absolutely.
That's what happens when you don't have doctors, when you don't have an infrastructure that's working. So the Comstock Act would just speed up, and I think really it would be a devastating blow to what is already a crisis.
Thank you so much, Pamela. So I want to call on Nicole. There's a lot of momentum around repealing Comstock that's building, and you all at Ultraviolet have been instrumental in helping build that momentum. You've put out petitions, you're doing a survey. Tell us a little bit, what the vision is for Ultraviolet's work in that area and how you're trying to both educate and mobilize people at the state level and across the country around this issue.
Thanks, Jody. So Ultraviolet is a national feminist organization, and we have an online community of about 1 million members. What we know, thank you. What we know about Comstock, GSG, there was a survey done by the Hub Project about a month ago. And the key finding there is that we know that Comstock is actually widely unknown. People don't know what it is. But the survey also showed that when people are educated about Comstock and they understand the potential impact of the law, that they're ready and support changing the law. That's 70%. At Ultraviolet, we've launched a petition to rally support from our members. It's been signed by over 20,000 people. A majority of our members are women voters and largely progressive women voters. We also did a survey of our members to kind of test these assumptions, right? Like, if we were to educate our base of supporters, would they be supportive of changing or repealing Comstock? And the answer is yes. Comstock is an animating issue for our constituency base. What we found, we tested 3 different messages. We tested a message that was very simple, and it was, Comstock is a 150-year-old extremist abortion ban that could be resurrected to ban abortion nationwide.
Did Comstock put you up to that?
I know.
Anthony!
There we go.
There we go, yay.
I think it's working now.
Okay.
All right, it was turned off.
Okay.
Thank you.
Tap it.
Yeah.
There we go.
Yeah, it's working. What was it?
We're talking about the messages. That's super
Thank
interesting.
you.
Yeah.
All right. So we tested 3 messages. The first one was very simple. It was about just Comstock calling it an extremist ban that was from 150 years ago that was put into place before women had the right to vote. The second messaging framing we tested was connecting Comstock to Trump and Republicans' agenda. And the third messaging framing that we tested was kind of the more nitty-gritty, what is it called, explanation about Comstock, about exactly what it would do, about banning, that it could be used to ban medical supplies to abortion providers from being mailed, right, or medication abortion from being mailed. And what we found is the simplest message performed the best. People are so worried, women voters are so worried about a national abortion ban. And so in our subsequent advocacy efforts, we're sticking with the very simple message as we continue to educate not only Ultraviolet members, but the broader electorate about what is at stake by keeping Comstock on the books. We're also, educating folks exactly like not shutting up about it is really important. We need to keep talking about it. We need to make Comstock a very well-known threat in our communities. So I encourage everybody to go out after this and talk to your friends and family about Comstock. The other thing is just organizing, making sure that we are supporting Senator Smith's bill. We found that, not only is it a bill that addresses an immediate need related to abortion, but it also is a fantastic vehicle for organizing folks. It's a bill that we've used to open up entry points for people who didn't know anything about Comstock and drive them to take action, right? So it's keeping that drumbeat going. And then finally, I'm sure everyone's noticed that Republicans all of a sudden are trying to distance themselves as much as possible from the abortion bans that they've fought for decades, right? And unfortunately, mainstream media is kind of repeating like their talking points. And even the New York Times had some allowed some misleading headlines to just like stay up there, right? And so for me, it's also about making sure that we don't let them get away with it. That's right. It's not like they're changing their plans, right? They're just trying to not be so loud about it, right? And so for us, it's about making sure that we're spotlighting every single time Republicans' actions speak louder than their words. And that's something that we all should do, just to make sure that, if they do use Comstock to take away our right to make decisions about our bodies, that they have to do it out in the open, and they can't do it in secret.
So just want to make a quick note here that I know the senator has to leave on the hour, and because I also want to leave a little time for questions from folks that have been here with us the whole time. I'm just going to ask a couple more questions and then make sure that we have time for that. Sarah, could you briefly, explain what concerns you've had from others about, not you personally, but have heard, I should say, have heard from others about repealing Comstock? Like, what are the counter arguments?
So there have been, I think, folks who have been concerned about this approach. I will say, I think so much of that has been allayed by how insane our Supreme Court is, and by how clear, if you listen to them and pay attention, the Republicans are about using this tool. So I just want to kind of give that bit of context that I really think, for the most part, the big we've moved past some of these initial concerns. The first is like the hope and a wish and a dream theory, that if we don't talk about it, maybe other people won't talk about it, and maybe the folks on the right won't talk about it, and then I don't know what, right? We see where that leads, but there's hesitation around that. And then there's a set of much more kind of technical legal arguments, but it really comes down to the same, like, I don't see you principle, right? Which is, and I know we're trying to move along, I'm gonna do this as fast as I can. Comstock, enacted before women could vote, hasn't been used to address abortion care in basically 100 years, since the 1930s. The last time it was used, courts were really clear that it has a very narrow application to abortions that are unlawful and in certain ways, right? So there is today, even without Roe, a very good and the correct legal argument that Comstock actually can't legally be used to ban abortion. So, okay, that would be important if we had courts that cared about things like law. And we had judges as opposed to like right-wing bloggers. So, you know, I think there are folks that are concerned that a court might read some action that we all take now to get this thing off the books as an endorsement of the like bananas right-wing theory of how they want to apply the law in the future. And the thing I would say to that is just, they don't need it, right? Any court that is going to uphold the Jonathan Mitchell Project 2025 theory of, you know, Comstock means women aren't allowed in public. I mean, whatever it is that they want to do, that court is going to get there with or without an attempt to repeal the bill. Repeal the act, rather. And that's why I think, you know, those concerns have mostly been put to rest.
Thanks so much, Sarah. And I have one more question for you, Senator Smith. Can you give us a sense right now of what things look like on the Hill and what we all need to be doing to ensure that lawmakers who do care about reproductive and sexual health, which everybody should, support repeal?
Yeah, well, thank you. Well, so first I would say that we just introduced this bill a couple of weeks ago, and I'm really excited that we already have, I think there are 23 of us in the caucus that have signed on, and we're looking to build that. And so anybody who is an organizer in this audience who wants to urge their members, and also there's been a bill introduced in the House as well, and that's very important. We have bills on both sides. So that's the first thing. Just, you know, talk to people about it. The second thing is, I mean, you know, blinding glimpse of the obvious, we're not going to pass the Comstock Repeal Act because, and I mean, in a different, you know, when we work really hard and we win these elections and we have a Senate majority, then we can reform the filibuster and then we can protect abortion rights in federal law. And we can also pass the Comstock Act so that it cannot be used inappropriately, illegally as a tool to ban abortion. So, you know, keep that in your mind if you need something at 3 in the morning to mobilize you to, you know, do even more work than you were already doing. But I just want to kind of amplify what Nicole was saying, because I used to be an organizer myself. This is a really powerful organizing tool. I used to call it, like, good issues in organizing is sticky. You know, they're like, the first thing when you hear about it, you're like, what the fuck, you know? And then you go, that can't be true. You figure it out. It's about something that you care deeply about. So it's interesting, it's engaging, it's something that you already care about, and there's an action step that you can take, which is to mobilize people around it. It is an excellent organizing tool, and for us, for right now, that I think is the power, and it's really fulfilling and exciting to think about what Ultraviolet is doing and what other Indivisible and what other groups are doing to help raise awareness of this, because what it does is it also, you know, as we have been saying on the panel, there's clearly, you know, Republicans can read polls too. And they understand that their positions on reproductive freedom and abortion rights are deeply unpopular. And so now they're trying to obscure those positions. A reporter yesterday asked me, Senator Smith, what do you think about the Republican platform, which no longer, you know, talks about a national abortion ban? And I said, you know, they can change their platform, but they cannot change their record. Right. And this is the way for us to demonstrate what they are really trying to do, what their record really tells us about who they are. And when people tell you who they are, believe them. And then take action like we all can to make sure that that is not the country that we have.
Thank you so much. So I want to go back to you offering to open the floor for questions. We only have until right before 5 so that we can keep to time for the senator's schedule. Before we open up to questions, I just want to say a couple things. One, thank you all for coming and learning about this. We're really gratified to have you here. Tell your friends, your people about this, and we can, you know, share information with you. And the second thing I wanted to do is to recognize another one of our partners who's not on the panel with us right now, but who was here earlier, All Above All, which is a really important organization that works on reproductive justice and other forms of justice. And we have a bunch of different organizations on the coalition that we work with, but They were actually in the audience earlier, and I didn't get a chance to shout them out. So again, does anybody have questions or thoughts or things that you'd like to know more about? Why don't you stand up and go ahead?
Hi. So I have not read your platform, but I have seen reporting that says that while it may be silent on abortion, it expressed some support for the concept of fetal personhood via the 14th Amendment. So that would basically open the door wide open to a nationwide ban via the Constitution. I'm wondering, is there any connection between that and Comstock, or is this a separate issue that we should be keeping track of as well?
Look, who wants to take this?
Yeah. Go ahead.
I'll take a stab at it, which is that, fetal personhood, I actually worked on a campaign that defeated a fetal personhood ballot attempt in Mississippi. So this is years ago, 2011, I think. It's been around for a long time. It definitely is a top priority for anti-abortion groups, both state and national. So with fetal personhood, then you don't need a national ban. If a fetus has rights, then, it will be protected through those rights. It basically would be extending the rights of citizenship to a fetus. The best example of how nightmarish that can be is the state of Wisconsin, and they have a law called the Unborn Child Protection Act, which was the result of the crack baby inaccurate fears of the 80s and early 90s. It's still on the books, and it is still enforced. It's funny how these horrible pieces of legislation that aren't repealed keep rearing their head. Every year, thousands of people who go into a hospital for a pregnancy test, they fill out their medical intake form and they indicate that they may have used drugs in the past. When they come back with a positive test, then the hospital calls CPS, a lawyer is appointed for the fetus, the case is taken through the juvenile court system, which if you're not familiar with that, that means that it's very much so private and hard to talk about it. And these women are given an option of either going into rehab for an addiction they might not have, or being placed in jail while this gets litigated. I've met people in Wisconsin who had this happen, and they literally had a judge show up in the middle of their medical exam. And there's a mandatory reporting part to it that makes it hard for providers to navigate that. So fetal personhood is a problem. As I said, thousands of people a year get caught up in this. I'll give you one guess what kind of demographics are most reflected in the people who are caught up in that. In one word, Milwaukee, basically. But with fetal personhood, that is the workaround to a national ban. And it's a little bit in the weeds, but basically it's like if you gave universal voting rights, then you don't need the Voting Rights Act. So if you give personhood to every fetus, then you don't need a national abortion ban. The problem is what it also does is what I described about Wisconsin. So it goes as far as the states do on protecting this fetus as a citizen. And that could be you didn't use sunscreen while you were pregnant, you drank caffeine while you were pregnant, you started an argument with your husband and he hit you, but you started the argument while you were pregnant. It can get, there's no end to how far it'll go.
One thing to note is that the right is really, really good about twisting language. When they talk about fetal personhood, a fetus comes later in a pregnancy, in the second trimester, really. Before that, you have a fertilized egg, a blastocyst, a zygote. You have all forms of development. And it's not, a fetus sounds like a whole child, right? A mom of 2 kids here. So what happens really is that, first of all, you don't know when the egg is fertilized, but if you possibly could be pregnant, you're not allowed to use contraception because it prevents a fertilized egg from implanting. And that fertilized egg is a person. So it really is both a disturbance of the word, the medical term, and also a sleight of hand, because we're not talking about, things that are even workable in the law, never mind physically. Sorry.
Can I
Sarah, I'm
add
sorry.
just one more quick point on that? And I think to your question about are there similarities with Comstock, yes, the try to confuse strategy is the same, right? The GOP did not take abortion out of the platform. The platform is not silent on abortion. The platform says we affirm the 14th Amendment right to life of everyone. And when they say everyone, they mean blasticists. So it's right there. It's just there in a way that is harder to explain and understand if you don't talk and think about these things all the time, in the same way that they don't refer to Comstock as the Comstock Act. They use the statute numbers to try to kind of further elide what they're trying to do. And just to bring it back to the court, because that's always what I'm here to do, since 1982, maybe earlier, every GOP platform has had a provision calling to basically amend the Constitution to provide for fetal personhood. Their language this year just says, well, we believe it, and another stage whisper, we have a Supreme Court that's going to do it for us, right? So like all of this is connected.
Anyone have any other questions? I want to make sure we can fit them in.
This one over here.
Yes? Oh, I'm so sorry. I was looking over.
Hi, my name is Becca Brubaker. I work at the Center for American Progress's Action Fund, or C4, CAP Action. I do partnerships work. I get to work with Tina Smith's lovely team, as well as Ultraviolet and a bunch of other folks on the Hill across the progressive movement. We're really focused on digital coordination and amplification work in the space. In my opinion as a strategist, I feel like this election is really going to come down to conversations in group chats, which I know many of the panelists here today have referred to. I'm curious about, kind of going off of what Nicole was saying about keeping it simple. If you've thought through, what are the most effective ways that we can arm people with information, both through social media and one-to-one contact, to have those conversations both in an online public platform, but also within those group chat spaces.
Yeah, so Ultraviolet is a digital-first organization, which feels very passé to say, let me just say. Because we've been around for over 12 years when digital-first was like a thing, right? But guess what? We're all online now. We all live lives on the internet. Anyway,
vanguard.
But the point is that we have been on the forefront of digital campaigning and organizing. So we've been thinking about this a lot. And we launched a campaign last year when mifepristone was going through a court challenge. Extremists were challenging the REMS around mifepristone for in-person dispensing, right? And we worked really closely with partners on pushing pharmacies to move forward with certification when the REMS were still in place but happened to be still being challenged in court. We were fighting a ton of medical and legal disinformation at the time. And we leaned a lot on doing brand creator partnerships. We have built a community of creators that have audiences who are interested in hearing more about reproductive rights. It's also key to find creators who are equally as passionate about the issue, because, no surprise here. I feel like we knew this 12 years ago too, but authentic content is still what resonates, right? So it's been a challenge to find the right pairing and matchup, but we've seen big returns on our partnerships. We recently partnered with about 18 content creators to test messaging around North Carolina's 12-week abortion ban to see if we could learn anything there, and specifically targeting younger folks and younger folks of color in the state. And what we found was that the content that was more earnest, like what I would say maybe during a speech about, I care about reproductive rights because I want control of my body, that tanked completely. And the videos that did really well were people that were infusing humor, that people were actually hooking the issue to a current like news or news story or event. And so it's a different way, I think, of thinking about organizing, because when I hear, when I think about the Comstock Act and kind of where we are now, I think about saturation. It's about making sure that we are saturating the internet with accurate information about the threat of Comstock. And right now, the way to do that really is through the creator ecosystem. I mean, in terms of tools, we're at the very early stages of testing messaging, but ideally we would have kind of the, the tried and true way to describe Comstock, which is what we're aiming for. So, yeah.
I also just want to add that the demographic that, as a former comms director, always was a challenge and is often not researched very well are, 25 to 54 middle-class white women voters. And, as a Black woman, I get a lot of messaging when it comes to this stuff. And I'm not sure that we've quite figured out what the hook is for that demographic. But whether it's online or not, I'm not an expert in that, but those conversations really matter, because the regret-see that I had to endure watching online after we lost Roe it was painful, it was sad, but it also is an example of a missed opportunity, that there was a false sense of security that is almost hard to believe when you think about the incredible bullhorn that was going off for a decade about this march towards the end of Roe. So I think we need to think in terms of, how are we using tools and how are we messaging, particularly for younger generations. But, I'm uniquely not qualified to talk about, to dive into that work when it comes to that demographic. But I think when I look at the last 3 elections, it's been back and forth and back and forth. And at some point we need to figure out how to articulate to that voting bloc that you are doing lasting harm, that there are consequences to that back and forth that involve the court. So here's some tools for you to think about things differently, that it's not about whether you want to have a beer with somebody. It's really about handing the tools of power to people who have really created some drama. When I'm thinking about the court particularly, that I've overheard conversations where people are like, well, that's so dramatic, that's so drastic. And I'm like, maybe 15 years ago it was, but we now are in a situation where what was once drastic has to happen. And we didn't get there because other people. We got there because people who should have come together and done the right thing at the ballot box didn't. And we need to figure out how to get them from that disconnect to, I have a role here and I need to do the right thing.
I want to, Bessie, do you want to say anything? No? Okay. So I want to close the panel now to thank you all again for coming and being with us today on this issue that I think is very, very important. And thank the panelists for being here, especially Senator Smith for taking time from her schedule. And Pamela and Nicole and Sarah, thank you for everything always. And any of you that want to get involved more, just let any of us know and we'll find a way for you to do that. Thank you so much.
Oh no, it's Comstock. Oh no! No! Cancel Comstock! Cancel! No!
Thank you all. Thank you. Don't thank you.
Oh my goodness. Thank you so much, Jody.
Thank you,
Thank you,
everyone.
guys.
I know.